PG Scholar in Enach, Kolkata. So today is Friday and as decided, we will be doing live session on study of Alan's Keynote. So last Sunday, we have discussed about ammonium muriaticum, we have discussed about ammonium muriaticum, and in today's live session we will be dealing with another medicine with alphabet A from Alan's Keynote. But before we start, I would like to request you all, if you are someone new to my channel and if you are liking my content, my videos, please do consider subscribing. It means a lot, it gives motivation to do more. Okay, so let's wait for a few seconds for everyone to join and then we will start. Till then, you can take out your Alan's Keynote, keep it handy with you, and the medicine which we are going to discuss is Asarum Europaeum. Okay, so it's better now. Hopefully you all are doing good. You're studying well, preparing well for your exam, and even if you are not someone who is an aspirant, study of Alan's Keynote is must for each and everyone who's into homeopathy. So even if you are not a student, you are a practitioner, this session will be helpful to you as well. So very short, very small, only one page medicine, only one page has been given to Asarum Europaeum in Alan's Keynote. Hello, good evening, Sonam. So only one page has been given, and in this only one page there are so many characteristic symptoms, keynote symptoms has been mentioned. When you learn this properly, you can prescribe and help so many of people out there. So if you have any queries, any doubt, anything, or if you want me to, like I had a poll like 2 days ago or yesterday only, where I asked on which topic you would like me to make videos, and I think 80% of the votes were for AIPGT preparation strategy. So yeah, now next video will be coming on the same topic. If there is anything special you would like me to cover, please do let me know. So today, let us start with Asarum. With Asarum Europaeum, very short, small medicine. What the news? Okay, sure. Yeah, we'll try to cover everything one by one. So actually there are so many things. Few people are requesting, they want to they want videos of allied subject like medicine and that and all those topics, and few want me to make videos on rubric hunting, organon of medicine. Actually even I want to do videos on like almost all topic, all subject, but then the thing is the time is very limited. It's easy to make video, but then editing is itself a big task, and I need to give dedicate like at least half an hour, 2 hours, something like that for editing. So that is something I actually avoid doing, because then in that time I guess I can do other things. So that's why I feel like I can do video, but editing is a bit difficult, time consuming actually. So that is why these days I'm avoiding shooting new videos. But let's see, if time permits, I will definitely try to cover all the subject. That will be helpful for me as well. Okay, so let's start. So Asarum europaeum. So Asarum europaeum, it's a plant. Basically, we found it in European countries. Okay, basically in Europe. So that's why the name, common name you can see is European snake root. Okay, in the name itself you can see European. So the common name is European snake root. It is also known as wild gnat, hazelwood, or Asara becca. Okay, these are the common names for this medicine. It is proved by Hahnemann himself, and it belongs to family Aristolocaceae. Okay, so this is the basic introduction. Aristolocaceae family, European snake root, proved by Dr. Hahnemann. The part used for preparation of this medicine is whole plant. Whole plant is used to prepare medicine. When you see the picture of this medicine, you can see there are many leaves, okay, and the leaves are kidney shaped. Okay, you can see like kidney shape is shape का इस तरीके से the leaves are there, or totally leaves are there, and in the between, in the middle of the leaves, you can find a purple small flower. Okay, and it is also known as a ginger, wild ginger. So it belongs to family Aristolocaceae, and whole plant is used. The class is class 1 because it is juicy. So mostly juicy plants are used, prepared in class 1. Okay. So the first line, very first line will give you hint of what is the medicine all about. So the first word itself is nervous. Okay. Nervous, anxious people, excitable or melancholy. Okay. Now you can see here the word is nervous. So this medicine affects your central nervous system mainly. Okay. So central nervous system is mainly affected by Asarum europaeum medicine. Okay. And the people are very anxious, they are excitable, or they are melancholy. Okay. Now for this word excitable, when we read this medicine from this Boric Materia Medica, you can find the word erethism. Okay, and what does that mean? Erethism means their excessive sensitivity. The sensitivity in these people, these persons are extremely high. Hello, good evening. So the sensitivity is extremely high, and for this in Boric the word has been used, that is erethism. Okay, and here in Allen you can see the word has been used excitable. So they are very excitable. Okay, and they are melancholy. Now what is the level of excitability, or this erethism is that they imagines he is hovering in the air like a spirit. Okay, you understand this? He's hovering in the air. जैसे हवा में उड़ रहा है. कैसे उड़ रहा है? Like a spirit. किसी आत्मा या किसी या सोल की तरह, किसी भूत की तरह, मतलब वो हवा में उड़ रहा है. इस तरह से वो खुद को इमेजिन करता है. And the same symptom you can find in neck can also. Okay, so basically this is central nervous system. This medicine acts on central nervous system. So in many of the CNS affections you can see this sensation. The next you can see is lightness of all the limbs. Okay, this is because of central nervous system, the nerves get affected. So in this medicine, most of the complaints are due to affection of nerves. So cold shiver from any emotion. Whenever a person is emotion, there will be cold shivering. Okay, there will be cold shivering or cold sensation. Oversensitiveness, as I told you that there is oversensitiveness of nerves. Oversensitiveness of nerve, this is fine, but the level you can see is that scratching of linen or silk or crackling of paper is unbearable. So oversensitiveness is to such a level that even the scratching, when this linen, कोई कपड़ा अगर है like this way only, इसको अगर scratch करते हैं, इससे जो noise होगा या जो आवाज थोड़ा बहुत आएगा, you can see it's not something which can be someone get bothered, but this person is so sensitive, so oversensitive, that even the scratching of the linen or even the crackling of the paper will be unbearable. Okay, and the The same symptom you can find in pyramid and paroxysm. Now, sensation as if ears were plugged up with some foreign substance. ऐसा लगता है कान जो है बंद हो चुके हैं, और बंद कैसे हुए? ऐसे कुछ अटका हुआ है कान में. There is something inside the ear and ear has been plugged up. When reading, sensation in eyes as if they would be pressed asunder or outward, relieved by bathing them in cold water. Okay, so the person feel like whenever he's reading, okay, there is sensation as if the eyes will be falling to pieces, okay, or it will be fall outward, okay, and this sensation the patient feels better by bathing the eyes, washing the eyes with very cold water. Okay, so cold water ameliorates in Asarum. Remember, although the patient is very chilly, very chilly patient, Asarum is very chilly. Now, cold air or cold water very pleasant to the eyes, and sunshine, light and wind are intolerable. Okay, so what it is that although the patient is very chilly, he likes cold air and cold water, and the sunshine, heat is not bearable, it is intolerable. Okay. Now nausea. Nausea in attack or constant. There can be constant nausea or it can be in attack, like in ipecac, and aggravation after eating. Okay, there will be aggravation after eating, but the tongue will be clean, like in ipecac you can see, like in sulfur also given here. Now nausea of pregnancy. If person like motion sickness is always there in pregnancy, so that time if pregnant lady is having nausea and other symptom match, Asarum can be prescribed. Unconquerable longing for alcohol, a popular remedy in Russia for drunkards. Okay, now you can see that unconquerable. The word is you can imagine the word, use of words, how beautifully the words has been used. This unconquerable longing for alcohol, मतलब जो desire सिर्फ desire नहीं है, there is longing, okay, and longing is unconquerable for alcohol, यानी कि patient को कितना extreme level पे मन होता है या habit होती है drinking की, alcohol की. Okay, so there is unconquerable longing for alcohol. It is a popular remedy in Russia for drunkards. Okay, so drunkards के लिए this has been a very popular medicine in Russia. Now, horrible sensation of pressing, digging in the stomach when waking in the morning. जब भी सुबह उठते हैं तो पेट में ऐसा लगता है कि कुछ प्रेस हो रहा है, कुछ दब रहा है, या फिर कुछ digging sensation. कैसे होता है? Like maybe because of hunger or what? We should not assume, but there is some sort of sensation of pressing and digging in the stomach when waking in the morning. And it is mostly after a debauch, okay, after drinking. Now, great faintness and constant yawning. This is also, you can see so many patients where, they are constantly yawning. We all yawn, but then that is something when you are very sleepy, when you are getting bored, or sometimes it's not like a whole day someone will yawn. But but this happens, many patients, they have this habit or they have this thing that they yawn continuously and whole day. Okay, whenever you see they are yawning. So if this is a symptom present, so constant yawning is Asarum you can prescribe. Okay, so great faintness and constant yawning is present in Asarum. Okay, now it is similar to causticum. In what way? In modalities. What are the modalities of causticum? That causticum is aggravated in cold and dry weather, and it is clear fine weather जब भी होगा तो causticum gets aggravated. Okay, so same way aggravation in Asarum is also in clear and fine weather. So it is similar to causticum in modalities. It is similar to allosocotrina, argentum nitricum, merc, porophyllum, pulsatilla and sulfuric acid in stringy and shreddy stools. Okay, stringy, the word is stringy and shreddy stools. Okay, stringy means like a string. Okay, tar jaise lamba. Okay, so stringy and shreddy stools. Okay, and aggravation in cold air, dry or clear fine weather like causticum. And amelioration is by washing face or bathing affected part with cold water. Okay, and amelioration is also in damp and wet weather. And it is followed by bismuth, causticum, pulsatilla and sulfuric acid. Okay, so this is in short about Asarum. So you need to remember that Asarum is European snake root, group by Dr. Hahnemann. Whole plant is used to prepare the medicine, belongs to the family Aristolocaceae, class 1. It is prepared according to class 1. And what else? It is a nervous. It affects your central nervous system. So the person will be nervous, very excitable. The word used in boric is erethism. Okay, excessive sensibility. Okay, then what else? It is a popular remedy in Russia for drunkards. Okay, so there will be unconquerable longing for alcohol. Okay, and there is sensorineural deafness. So nervous deafness is there in this patient. Also asthenopia, that is there is eye strain whenever the person is reading continuously, or nowadays we can see that when the person is using any long screen time, if it is there, watching TV, watching doing work on your PC, laptop, or using your phone constantly, and after that there is eye strain. And if that is better by washing your eyes with cold water, then the medicine is Asarum Europaeum. Okay, although the patient is chilly, it is always better by cold air and cold water. Okay, and oversensitiveness of nerves is there. Even the slightest noise, like slightest crackling of the paper or scratching of the linen, will affect the patient, affect the person. Okay, and there is nausea. Nausea is constant with clean tongue. It can be an attack or it can be constant, and there is clean tongue. And nausea of pregnancy is there. And the person has imagined himself to be very light and hovering in air like a spirit, and there is lightness of all the limbs. Okay, and what else? Something remaining. In ear, patient feel as if some foreign body has been plugged up. And there is constant yawning. There is faintness and constant yawning present. And aggravation is in clear, fine weather. Amelioration is by cold, and what else was? Yeah, damp weather. Yeah, water से amelioration है basically. So you can see wet weather will ameliorate, damp weather will ameliorate, cold application will ameliorate. Okay, cold air will ameliorate, but if the weather is clear, it is fine, it is dry, that will aggravate. Okay, and it is similar to causticum, to sulfuric acid, pulsatilla, ipecac, podophyllum. Yeah, and the stool is stringy and shrubby. Okay, so yeah, that is all about. And regarding MCQ, you can see that this sentence highlighted here, that is oversensitiveness of nerves, scratching of linen or silk and crackling of paper is unbearable. So this is asked as MCQ. And also remember that two other medicine are there for the same symptom, that is ferrometallicum and taraxacum. So total 3 medicines are there where nerves are very oversensitive: Asarum, taraxacum and ferrometallicum. Okay, so remember all 3 of them. But the line return is in Asarum. Okay, and other thing is this unconquerable longing for alcohol and a popular remedy in Russia for drunkard. This is also asked as MCQ. And this great faintness and constant yawning is another MCQ. You need to remember the aggravation and amelioration. Okay, that can also be asked. Okay, so that is all, nothing much about Asarum. So yeah, even from Borike, almost everything is similar. Remember that it is a nervous remedy. It will affect your central nervous system. Your nerves will be very sensitive, and hence there will be oversensitiveness physically as well as mentally. And patient has vivid imagination and he imagined himself to be hovering in air like a spirit. Okay, this symptom is also present in lichen. Yeah, that is all about Asarum, Europeum. So, questions from your side? Please do ask if you want to anything. At least say if you have understood it or not. Okay, first let's talk about Asarum and then we'll discuss anything else. Anything related to Asarum you would like to ask, Chetan? Okay. Nothing much, this is short, but yeah, MCQs can be asked definitely from this. Yes, we can use, but other symptoms should be matched. That is, the patient should be very chilly and other things you need to match, and then yes, definitely you can prescribe. The exact line has been given that it is a very famous remedy in Russia for drunkards. Anything else? More questions? Nothing. Are you people even studying or not? You never have any question to ask. You would like to share? Chetan, you would like to share one case? Okay, nothing, no questions. So let's proceed. Regarding Narela, yeah, so many people are asking about Narela. See, Narela is very new. It has just opened last 2 months ago. But then it has started functioning. The hospital, the OPDs has started functioning. But for admission and that too for PG admission, you need to go through that institute need to be go through so many processes. So Narela is into that phase for now. So hopefully all the admissions will start next year, that is in 24, and before it start we will get, definitely we will be getting notification prior. And as I have told you earlier, there will be materia medica, repertory, and it was I think medicine and pharmacy. This 4 subject will be there for post graduation. Tentatively, not like this is not exact confirm, but yeah, tentatively these subjects will be there in beginning for post graduation for MD. But now, like I think when there will be, AIPGT 24, then those aspirants will be eligible to take admission in Narela. Okay. Now those preparing for this time for 23 are not eligible to take admission into Narela. This is for now, but who knows what will happen in future. So I can't be. These are not the last words. So anything can happen. If it starts functioning this year and people are eligible to get admission this year, that will be well and good. Otherwise, from next year, it will be functioning, and students will be able to take admission there. Okay. So now coming back to the topic. Okay, I'll ask. Yeah. Okay. So I'll ask you a few questions. Quickly, let's see who all can answer. Okay, so the question will be from Alan's Keynote. I'm teaching you Alan's Keynote, but please do remember that questions will also be asked from Borix Materia Medica in your examination. So please do read Borix Materia Medica. Whatever medicine we are reading from Alan's Keynote, just go through Borix Materia Medica. The same medicine, go through from Borix Materia Medica as well, because questions are asked more from Borix Materia Medica as well. Okay. So once we finished with Alan, we can start with Borix. What all to do? Okay, tell me now. Excitable, irritable, sensitive for the nervous affection of onanist of both sex. Okay, I hope समझ आया है. So the person is excitable, irritable, sensitive. Okay, for the nervous affections of onanist of both sexes. Okay. This is the question. Now options. A. Staphysagria. B. Gelsemium. C. Valeriana. And D. Coffea cruda. Okay. So tell me answer. A. Staphysagria. B. Gelsemium. C. Valeriana. And D. Coffea cruda. Okay, in Alan's Keynote, where this under which medicine you can find this line. Excitable, irritable, sensitive. Excitable, irritable, sensitive for the nervous affections of onanist of both sexes. Okay, tell me. Under which medicine we can find this sentence, exact sentence. Anyone? Okay, one hint that after this sentence, very good. Sonam. Yes, very good. Before hint, you have answered. Well done. So yeah, the correct answer is Gelsemium. You can find in Alan's Keynote on page number 128. Yes. On page number 128, you can find this exact sentence under Gelsemium, and in bracket you can also see Califos is another medicine. Okay, Califos is another medicine for onanist of both sex. Okay, next is fits of uncontrollable weeping and profound melancholic delusions. No. The first answer was Gelsemium. Okay. Cipra. The answer was Gelsemium. Next question is fits of uncontrollable weeping and profound melancholic delusions. Options are A. Helonius, B. Calibrome, C. Medorinum, and D. Sepia. Question again. Fits of uncontrollable weeping and profound melancholic delusions. Helonius, Calibrome, Medorinum, and Sepia. What is the answer? Where you can find this sentence? Okay, tell me, anyone? Fits of uncontrollable weeping and profound melancholic delusions. Good, great. Chetan, Kali Brome is the answer for this. Yes, correct answer is Kali Brome. You can find the sentence on page number 152, first line. Under Kali Brome, fits of uncontrollable weeping and profound melancholic delusions. Yes, Kali Brome is the correct answer. Good, very good. Now for the bad effect, next the answer was Kali Brome for this question. Next question is for the bad effects of abortions and miscarriages. Okay, which medicine can be given for bad effects of abortions and miscarriages? Miscarriages, it is in plural. Okay, mind you, it is abortions and miscarriages. Okay, A is Alteris Nosa, B Sabina, C Murex, and D Helonius. Tell me. Which is the medicine? Where it is written in Allen's Keynote. Under which medicine we can find this exact line for the bad effects of abortions and miscarriages. Sabina, although is indicated medicine clinically, but the exact line is not written under there. Alteris farinosa, Sabina, Murex, Helonius. Correct answer. Anyone? Great, very good, Aishwarya. Yes, the correct answer is Helonius. No, Sandeep. The answer is Helonius. On page number 137, you can see in Allen's Keynote under Helonius Dioka or before relationship. Second last line, you can see the bad effects of abortions and miscarriages. The medicine is Helonius, remember, okay? Helonius is for bad effects of miscarriages and abortions, okay? Helonius. Okay, now tell me exostasis of bones of face. Facial bone का exostasis होगा तो medicine is fluoric acid and hecla lava. Yes, together this is given. Option A is fluoric acid and hecla lava. Option B is silicea. Option C is fluoric acid and coca. And option D is all of them. Yeah. So tell me, exostosis अगर bone का होता है, bone, not only bone, facial bone, okay? So exostosis of bone of face. Options: fluoric acid and hecla lava. Option B, silicea. Option D, fluoric acid and coca. And option D, all of the above. This is the answer. Bone of face. Always remember, one medicine is very, very peculiar for us. Yes, correct, Aishwarya. Very good. Fluoric acid is the medicine. Definitely, you cannot find hecla lava in Allen's Keynote, but under fluoric acid, you can see. Wait a minute. Yes, exostosis of bone of face. before relationship on page number 127, and in bracket you can see Hekla lava is also given. Okay, so this is the answer. Exostosis of both. You can see question कहाँ से frame हुआ है. Yes, fluoric acid and Hekla lava. Very good. Now you can see, if you have Alan's keynote with you, just open page number 127 and just see the question MCQ has been framed from where. Just before relationship, very small line. Okay, before that a whole line is given, that rapid carries of teeth, fistula dentalis or lacrimalis, and after that exostosis of bone of face and Hekla lava. So you can see they have from wherever they can pick MCQ and ask you in the exam. So you need to be very thorough with each and every remedy from Alan's keynote. Okay. So yeah, correct answer was fluoric acid and Hekla lava. Good, very good. Now tell me, this is easy. So tell me fistula in ano alternate with chest symptom. No options if you can. Let's see. Fistula in ano. हमने ये remedy की है and we have discussed this earlier. Tell me. Calcarea false. Okay, very good. Correct. Right. More. One more. And under which medicine we can find answer to this question? Tell me also. Under which medicine we have discussed? Yes, very good, Aishwarya, correct. Okay, so fistula, under which medicine we have discussed this? Tell me. In Alan's keynote, where we can find this line? Tell me. Okay, Aishwarya, you only tell me because you have to answer it correctly. Under which medicine? Yes, Anisha is correct. Under which medicine? Okay. More? Anything else? बस दो ही लोगों ने दिया आंसर, बाकी लोग So fistula in ano alternate with chest symptom. The options were Cilicia, option B Berberis, option C Calcarea falls, and option D all of the above. And the answer was all of the above. The medicines all were Berberis, Vulgaris, Cilicia, and Calcarea falls. Okay. Okay. Now next is okay. So next question is, flesh feels as if beaten from the bones. Flesh feels as if bitten from the bones. Options are option A ipecac, option B agaricus, option C thuja, and option D restox. Which is the answer? Flesh feels as if beaten. Read very carefully, okay, because options are very similar. All this medicine has something related to flesh, okay. Thuja you have said. Let's see. Flesh feels as if beaten from the bones. Options ipecac, agaricus, thuja, and restox. Okay, and the answer is correct. Shipra, you have answered it correct. Thuja is the answer for this. Okay, so you can see thuja on. Wait a minute. Flesh feels beaten. Okay, yeah, you can find this sentence on page number 294 under Thuja. Okay, नीचे से fifth, fourth, fifth line, and under that you can see phytolaka is also given, and in bracket it is written if the sentence is like flesh feels as if scrapped. Okay, if it is given as if scrapped, then the remedy will be rustrox. Okay, so yeah, then general depression from heat of sun or summer. Okay, means patient is unable to tolerate heat of sun or summer, so there will be depression. So great depression from heat of sun or summer. Options are A. Gelsemium, B. Clonine, C. Lachesis, and D. Natramure. So you can see all options are given where sunlight or sun heat aggravates the patient. But what is expected is कि ये exact line एलेंस की नोट में कौन से मेडिसिन में लिखी हुई है. You should know this. Okay, so tell me. General depression from heat of sun or summer. Option A is Gelsemium, B. Clonine, C. Lachesis, and D. Natramure. Okay. So option is correct. Cipra again correct. Gelsemium is the correct answer. Okay, so you can find this exact line written under Gelsemium. Yeah, Gelsemium. Ashwarya, correct. Yes, so where you can find this on page number general depression. Yeah, you can find it on page number 128. Okay, middle. Very good, Aishwarya, Shipra. What tell me medicine from if the patient is having epilepsy from jealousy. Patient is having epilepsy from jealousy. Options I'll give you. Option A, Apis mellifica, B, Cuprum metallicum, C, Lachesis, and D, Secutibros. This is all medicines are having epilepsy in them, and all the medicines are having picture of jealousy. But you have to say epilepsy from jealousy. Which is the medicine? Epilepsy from jealousy is Apis, Secuta, Cuprum, or Lachesis. Epilepsy from jealousy. Right, correct, very good. Sonam, yes, very good. So the correct answer is Lachesis, and you can find it like on page number 159 in Allen's keynote. You can see this is not the exact sentence or direct sentence given. You can see the sentence is written as epilepsy comes on during sleep in bracket bufo from loss of vital fluids, onanism, then jealousy. Okay, and the question frame is epilepsy. Here you can find the word epilepsy. Okay, this beginning of the sentence, and the sentence will add with the sentence is ending with the word jealousy. So the first word of the sentence and the last word of the sentence are together taken, and then the question is framed. Okay, so you should know the whole sentence in order to answer the question, right? So in but the benefit of discussion or giving mock test or solving MCQ is this only, because कितनी भी अच्छे से हम अगर पढ़ लेंगे तो then because we are being human we are tend to forget. Okay, so कितने भी अच्छे से पढ़ने पर भी there is a tendency to not to recall at that moment, that particular moment of time. But if we discuss it this way, if you are solving MCQ, if you are giving mock test, then you get familiar with such questions, and then if such question comes in exam, you can very confidently answer them. So this is the whole motto of doing this live session as well, so that you get familiar with the medicines, with what all sentences are written under each medicine, and how the MCQs are framed. Okay, so that is all the whole motto of doing this live session. Hopefully you all will be benefited from it. Now tell me, fear of death during pregnancy. If the person or patient is having fear of death during pregnancy, which medicine to be given? Porphyrin, Phytolacca. Yes, that should be the thing, because this is something, this medicine we have read from first year, since our first year. So ये तो एकदम बाय हार्ट होना चाहिए. Okay, so fear of death during pregnancy. The option I was supposed to give were Porphyrin, Phytolacca, Gelsemium, and last aconite. And needless to say, the answer is aconite. Okay, aconite on page number, I think. Wait. Well, Cipra is given, no? I think Cipra. Yeah, on page number 14 in Alan's keynote, you can find last line of first paragraph, fear of death during pregnancy. Okay, so yeah, very good, correct. And it's 6 minutes or 5 minutes will take. Okay, tell me medicine which follows spigelia in heart disease. Spigelia is good medicine for heart conditions, and which medicine follows spigelia in heart diseases? The options are A. Naja, B. Phosphorus, C. Digitalis, and D. Calmia. Okay, which answer is? Tell me answer. Follows spigelia. Very good, correct. Calmia is the medicine which follows spigelia in heart conditions. Very good. Okay. Calmia, yeah, correct answer. Calmia is the answer for this. It follows spigelia in heart condition. Very good. Okay, very good. I'm happy you people are studying well. Okay, now tell me fissures of nipples in nursing woman. Okay, if there are fissures in nipples of a nursing woman, which medicine can be given? Option A is graphitis, B sepia, C retania, or all of the above. Which is a medicine to be given? Okay, and under which medicine you can find this sentence? Fissures of nipple in nursing woman. Graphitis, sepia, retina. But under which medicine we can find this sentence? Correct. Very good. On page number 239, you can see before relationship, there's a sentence written under retania, that fissures of nipple in nursing woman. In bracket, you can see two medicine given, that is graphitis and sepia. Okay. Retania. Very good. Yeah, it was already told by Aishwarya first. Yeah, good. Very good. Aishwarya, Sonam, Cipra. Very good. Good. Okay, last question. Tell me, there is fear of death, but fear of death and utter lack of courage. Fear of death due to lack of courage. What are the medicine? A. Aconite, B. Gelsemium, C. Nux vomica, or Arsenicum album. There is a medicine for this fear of death. fear of death, utter lack of courage. Utter lack of courage. Anyone? This exact sentence नक्सवामिका में क्या लिखा हुआ है? You can see in Naxwamika the sentence given is anyone? Where it is written, in which medicine? Fear of death, utter lack of courage. A. Aconite, B. Gelsemium, C. Naxwamika, D. Arsenicum album. Arsenicum album, you can find the sentence fear of death. But उसके आगे लिखा हुआ है utter lack of courage. Okay, so arsenic album is not the medicine because it has only fear of death. Okay, in Naxwamika it is not written. Aconite may be fear of death, but the word utter lack of courage is written under Gelsemium. Okay, you can see Gelsemium में first sentence is fear of death bracket में arsenic, and after that you can see continue sentence that utter lack of courage. दोनों सेंटेंस कंबाइन करके जब पूछा जाएगा तो द मेडिसिन इज जेल्सीमियम, नक्सवामिका एंड आर्सेनिकम एल्बम. ओके, आंसर इज जेल्सीमियम. ओके, ओके, सो एनीथिंग 5 minutes you can ask your questions quickly. Quickly. Anything you would like to ask? No questions, no doubt, everything clear? Good, very good. So it is like complains of nothing and wants nothing. Which medicine? Little medicine, complains of nothing and wants nothing. Correct. So you people are like opium. You want nothing, you complain of nothing, you want to ask any question. Okay, that is good. Opium is correct. Yes, opium is the medicine where patient is complains of nothing, wants nothing. Okay. Okay. So yeah, if there is no question from your end, then I think that was all for today. We'll wrap up today's session. Nothing to ask now. Next medicine, any suggestion for next medicine on Sunday? Sunday 8:30 p.m. we will discuss another important medicine. You would like to suggest anything? Any specific medicine you want me to take first? Or I can choose randomly. Okay, come on, tell me quick. Ferment. Okay. Okay, fine, fine. Okay, so as we are doing, okay, someone asked about the case. I think, I don't remember name. Okay, someone asked about the case. So basically, what is happening that we are doing a study of Allen's keynote. So I'm focusing mainly on the medicine, how it is given into Allen's keynote, and if it is also possible that we can discuss a whole picture of that medicine, how will be the person and this and all, that will be, you know, sum up of all the materia medicas, different materia medicas. I can read and then tell you how is the overall picture of that particular medicine, and then after that we can discuss a case, which is a very fine and a very nice way of learning that medicine, and this is the ideal way of studying materia medica. But then this is something which will not be, pinpoint or exam point of view. When you are studying for any entrance for MCQ, the method of teaching and method of studying is very different from what we do when we are learning to, remember it for long or for practice and all those purpose. So that is the reason I'm not discussing any case or symptoms from any other books. Okay. Uh, I'm just sticking to Allen's keynote because this is something from where the questions will be asked. Okay, so that is why I'm not, referring other book. Although I am referring, I do study before teaching, but then I'm not mentioning any other book so that you people don't get confused. Okay, I'm just reading from this so that you can remember that Allen's keynote में इस medicine के अंदर ये sentence दिया हुआ था, and if that sentence come as MCQ in your exam, you will be in a position to answer it correctly. Okay, that is the whole purpose of doing this, and that is the reason I'm not discussing any case. If you want me to discuss, because we have a lot many cases in OPD, every day we see so many cases, and now too we are getting so many follow-ups as well, and so definitely I can discuss how I have come to that medicine, if follow-up is good, how was the result, and if not good, why it was a fail, and all those sort of things. Okay, if you are interested we can do that as well, but for this Friday and Sunday in this live session I will be discussing only Allen's keynote. Okay, so hopefully you understood it well. So that was all for today. Thank you so much for joining. Take care. Bye bye. Good night.